Okay, as we move further along in our patient care, now we're going to talk about something that's very important, and that's normal postural control. We always talk about posture, but when it comes to the neurological patient, postural control is very, very important. And postural control is critical to independence in functional tasks such as sitting, standing, walking, ADLs, which would be activities of daily living. So clinicians need to understand that impaired postural control is a common problem in both the geriatric and neurological patients. So a decrease in control leads to reduction in ADLs, increased risk of fall, increased risk of mortality and morbidity. So this chapter will focus on research explaining the neural basis for normal postural control. So remember, we always need to understand how the brain works in order for us to help our patients. If we just kind of blindly go at helping our patients and we don't really understand how the brain works, then you're not going to get the results that you really need. So here's a good introduction, and basically here's the task, here's the individual, here's the environment, but guess what ties everything together? Postural control. So postural control plays a role for the individual, the task, and the environment. Now, if you look at evidence-based practice, again, we always like evidence. So there's research, and then it goes into clinical practice. Then clinical practice will lead to more research, and it's a continuum. So the neural basis for normal and impaired balance, there's clinical methods, there's tested measures for examining balance, and there's evidence-based treatment of impaired balance. Okay. Now, what factors are likely contributing to imbalance in my patient? What strategies can I use to assess balance in my patient? What strategies can I use to treat balance in my patient? So these are all the things that we'll look at research, we'll look at clinical patterns, and then formulate a plan to give the best possible results for our patient. Now you're probably thinking, you're like, well, Patel, of course posture is important. And although there's like a universal agreement that yes, postural control is critical to functional independence, unfortunately, clinicians do not necessarily agree on the best way to assess and treat impaired postural control in their patients, because whether they've been doing one thing for many years or they've been taught a different way, or what one article may say versus the other, there's a lot of things that can play into it, and unfortunately the clinicians don't all agree on what's the best treatment. So what is postural control? So here's a good definition. Postural control is controlling the body's position in space for dual purposes of stability and orientation. And that's posture, balance, equilibrium are all synonymous. So this takes a lot of postural control. All right. Postural orientation is the ability to maintain relationship between body segments and between body environment for a task. So he's got really good postural orientation. Okay. So make sure you know the difference between postural orientation and postural control. Now, defining postural control again, postural stability is the ability to control your center of mass in relationship to your base of support. Center of mass is a point at center of total body mass. Your center of gravity is the vertical projection of your center of mass. So on Earth, and for most objects, this means the same thing. Okay. So just to kind of clarify, the center of mass and center of gravity for almost all the objects on Earth are the same, right? Except for maybe the Sears Tower is 1 millimeter lower, but that's negligible. But also in the book, if you see the words posture, balance, equilibrium, they basically all mean postural control as well. So sometimes you'll see it used synonymously. Now, if you look at posture in a nutshell, right, we have the line of gravity. It should go through a mastoid process of the skull, the shoulder joint. Here's your center of gravity. Here's the hip joint. Here's the knee joint and the ankle joint. It should be a plumb line that goes through here. Now, think about this. Here's at 0 degrees, you only have 10 to 12 pounds of pressure. If you go further down, you have 15 pounds of pressure. I'm sorry, at 15 degrees, you have 27 pounds of pressure. At 30 degrees, you have 40 pounds of pressure. At 45 degrees, you have 59, and at 60 degrees of you texting all the time, you have 60 pounds of pressure that has been put on your neck. So that's why postural control and posture is important, because if we maintain this plumb line, you're putting minimal stress on your neck and your shoulders, whereas by putting your neck in 60 degrees, you're adding 60 pounds of torque on here. So that's why maintaining good posture while you're online, Zoom, or doing your homework is very, very important. So when you look at this diagram, you're just thinking, okay, let's talk about postural control, equilibrium. So both the task that you're doing and the environment that you're in influence the orientation and stability demands of the task. So for example, look at A, the task of sitting on the bench and reading has a postural orientation requirement of keeping the head and gaze stable and fixed on reading the material. So the stability requirements of this task are kind of lenient, right? Since the contact of the body with the bench, back, and seat provides a fairly large base of support. The task of standing and reading the book has the same postural orientation requirement, but the stability requirement, obviously, is more stringent. And then the task C is very different from the task of balance during stance, since when walking, the center of gravity often falls outside the base of support. So trying to read while you're walking obviously takes a lot more effort than standing and then walking versus sitting then walking. So that's why how postural control affects the task and how it affects the environment. So meaning, let's say you had a patient that has neurological issues, you're not going to have them read and walk first without having them being able to sit and walk or sit and read first. Meaning a lot of clinicians, PTs or OTs will try to do something that's more complicated when the patient can't even do the simple baseline. And this is just an example, but I'll give you more examples. So really, does it make sense? Are you going on the continuum, and are you progressing your patient safely and successfully? That's the key. Now again, the base of support is the area of body in contact with your support surface. So that could be your hips, could be your feet. Your center of pressure is the center of distribution of total force applied to the supporting surface. All tasks require postural control, and stability and orientation demands change with each task, whether you're reading a book, going up and down stairs, lifting, reaching, etc. Task and environmental influence orientation stability demands of a task. Specific orientation and stability requirements vary according to task and environment, of course. So the role of the task and the environment. Postural orientation and stability will vary with the task and environment. So if you're hiking, playing golf, surfing, stability and orientation. So we need a systems framework for postural control. Ability to control body's position in space, complex interaction of musculoskeletal and neural systems, postural control system. Okay, so the postural control system is your musculoskeletal MSK system and your nervous system working together, and that can include range of motion, flexibility, and strength. Now the neural components, there you have a whole bunch of motor processes, you have sensor processes, you have higher level cognitive, that's your visual, vestibular, and somatosensory. So if we take one out, then the other two have to work harder. If we take two of them out, then one has to work harder. So we'll talk about vision, we'll talk about balance, and somatosensory. And these are all neural components. So how do we progress them? All right, and how do we do that? We can take one system out at a time, take them all out, etc., etc. So if you look at the task, the individual environment, again, that's your posture, postural control. What affects that? Well, it could be musculoskeletal, it could cognitive, it could be muscle synergies, sensory systems, sensory organization, cognitive, do they even understand what you're trying to tell them? So these postural systems will all be affected from the individual. Okay, so there's a lot of things that we can control the task, we can control the environment, but from the individual standpoint, there are some things from the postural system we cannot control. right? Sometimes we can't change cognitive resources. Sometimes we can't change cognitive strategies, sensory organization. Okay, so that will definitely influence posture. Now, a systems framework for postural control. Now, this is very important for you to understand the difference. You have, what are the constraints from doing a task? You have balance control, so you have a steady state. That means the ability to control your center of mass relative to your base of support in a fairly predictable, non-changing condition. Meaning, when you're sitting, when you're standing, and you're walking straight, that's pretty steady and it's a state. You can control your center of mass, you can control your base of support. Reactive means recover a stable position following an unexpected perturbation. So let's say, how's your reactive balance? Meaning if somebody bumped into you in a crowd, or if you accidentally tripped on something, how's your reactive balance? For most of us, if somebody bumps into us while we're in the mall, or if you trip over something, you're not going to fall to the floor. But think about a patient that has a neurological disturbance to begin with. A slight bump, slight deviation, or a slight little thing on the floor can throw their entire balance control and postural control off. So then we would have to work on their reactive control. Now, proactive balance, that means you activate muscles in potentially destabilizing voluntary movements. So lifting a heavy bag of groceries usually leads to falls if nervous system is compromised, meaning if you don't understand that you're going to lift a heavy bag of groceries, if you don't actually prepare for that, then when you go to lift the heavy bag, you might hurt your back or you might fall forward. So this proactive balance is what usually leads neurological patients to falls, because they can't be proactive in thinking ahead and saying, okay, wait a second, I need to step over that curve that's slightly cracked. They can't think ahead sometimes, or they say, okay, I'm going to lift something, and they just think everything weighs the same, and when they go to lift something heavy or too light, they overreact or underreact, and they can fall forward or fall back. So a systems framework for postural control, task restraints. Again, you have feedback control, occurs in response to sensory feedback from external perturbation. So for unexpected postural disturbances. And then feed forward control, you have an anticipatory postural adjustment made in anticipation of voluntary movement. So you anticipate something and you're gonna, for expected postural disturbance. So you know that, hey, if I walk into that crowd, I may have to tighten up a little bit. I have to be careful. So you anticipate those adjustments that are taking place. For a neurological patient, sometimes they can't anticipate that, and that's what leads to falls. So again, we as individuals without neurological issues, we take a lot of this for granted, but you don't realize how much effort it takes just to maintain good posture. Walk in a crowded grocery store, get in and out of the car, go up and down stairs, just walk in general takes a lot of control, and we don't realize how much until we have an issue. So a systems framework for postural control is you have environmental constraints such as changes in support services, differences in visual and surface conditions, and multiple tasks. So what I'd like you to do, too bad that we don't have a chance to do this, but what I'd like you to do is once in a while check your posture, and we would have done this in class, but if you just stand there and we look at your posture, if we were to draw a line through here, it should go through your ear, should go through your shoulder, midway through the trunk. It should be slightly anterior to the center of the hip, slightly anterior to your knee, and slightly anterior to your mid ankle. So it should be a pretty good line that goes up and down. Now again, it says with your partner, I want you to check, but you really don't have access to your partner. So it'd be good that if you can just once in a while check this, check your posture, and maybe you guys can, I don't know how we can do this. If you have any suggestions, maybe you guys can take a picture and draw a line through there, and that would be a good way to submit that, because I'd like to see your posture, maybe a side profile, and then draw a line through it. I think that, I'm sure most of your phones will allow you to do that, and then just drawing that line and see, hey, are your shoulders forward? Is your hip back? Is your knee forward? Are your ankles forward? That'd be a good thing to turn in, so we can take a look at these postures and look at that. So let's talk about steady state balance. And when you think of steady state balance, basically that's you're just sitting there or you're standing in place. So a lot of times people think that that doesn't take a lot of postural control, but in fact it does. Just to stand there, your muscles are working so that you don't fall flat on your face or sway back, right? So your anterior tib, your soleus, your gastrocs, your biceps, your abs, your glutes, erector spinae muscles are pulling, relaxing, contracting to make sure that you have a balance. And we take that for granted, but there are a lot of postural control muscles that are working, uh, um, even just standing still, sitting. Okay, so body alignment can minimize effective gravitational forces. Muscle tone keeps body from collapsing in response to the pull of gravity. And you have intrinsic stiffness of muscles, you have background muscle tone, you have postural tone. So there's a lot of things that keep you upright that we don't really realize. But what's really the definition of muscle tone versus postural tone? So muscle tone refers to force with which a muscle resists being lengthened. Postural tone are anti-gravity muscles to counteract the force of gravity. So the majority of anti-gravity muscles that maintain the erect position are the gastroc and soleus, tibialis anterior, hamstrings, quads, glutes, spinal flexors, iliopsoas, neck extensors, and neck flexors. So when we're talking about postural tone, we want to work those muscles. We want to work the anterior tib. We want to work the gastroc, quads, hamstrings, glutes, spinal flexors, spinal extensors, neck flexors, and neck extensors. And that should keep you in a nice upright position. Okay, so muscle tone refers to the force with which a muscle resists being lengthened. So if you have really high tone, then you're not going to be able to stretch as much. And certain neurological patients have a high amount of tone. So explore the motor strategies used to control quiet stance with a partner. Observe body movement in conditions 1, 2, 3, 4, and 5. And again, this is something that we would have done, which is a great little task to do. Unfortunately, we don't get to do some of this stuff, which is unfortunate. But what we would have done is we would have just looked at your static balance, standing in place. We would have pushed each other from the side, had you close your eyes, had you open your eyes, reach for something, and see how your postural control was, how your reactive balance is. So you can look on page 163 of your book and kind of see how that would have been fun to do. So as we talk about, remember Michael Jackson, if you look at these movement strategies, actually, come to find out, he actually cheated the system. He would actually lock into place and then he'd be able to go down there. So it wasn't really good postural control. But this would be a good ankle strategy. And we'll talk about the difference between ankle strategy, hip strategy, a step strategy, and then step and reach. So that's how you control that. But if you have good neurological control, you'll use the ankle strategy. If you have poor ankle strategy, you'll start to use your hips. If you can't use your hips, you'll have to step forward to gain your balance. And if you can't use that, you'll step forward to gain your balance. But stability limits, point at which a person will change configuration of his or her body base of support to achieve stability. So the ankle strategy is the best to use. Then we go into the hip strategy. Then you step and reach. Okay, not fixed boundaries, affected by perceptual and cognitive factors. Now, what are some clinical applications of research? We've got the Berg Balance Scale, and I uploaded the Berg Balance Scale, and you can do that on a family member for some extra credit. We'll go over that at our break. Observing alignment of body segments, observing stability, observe how much center mass moves relative to the base of support. So let me show you that Berg balance test again, so you kind of have a good review. Again, So here's the clinical applications of Berg balance scale. Sitting balance, how can they sit unsupported? Standing balance, can they stand unsupported, stand with their eyes closed, stand with their feet together, stand on one foot, turning to look behind, retrieving objects, tandem standing, reaching forward with an outstretched arm. So these are all scales. How about dynamic balance? Can they do sit to stand? Can they stand to sit? Can they transfer? Can they turn 360 degrees? And can they do a stool stepping? So it's a total score of 56. If they score less than 45, then they have some issues with their balance.